10 more cases of Zika confirmed near Miami. The Centers for Disease Control and Prevention issuing a travel warning for a very specific area. It includes pregnant women who have traveled to the area since June 15th. Joining us now is NYU School of Medicine Associate Professor Dr. Devi McDowell.
It's perfect.
See, I said it wasn't even in the prompter.
You got it right.
Dr. Devi, tell me how rare this kind of travel warning is for Zika, but also to identify a single neighborhood in a city. It's the Wynwood neighborhood in Miami.
Sure, it's extremely rare. I mean, this is arguably the first time the CDC has ever done this for a neighborhood in the U.S. also. Usually the travel warnings are against some foreign country. But in terms of people worrying at home, you know, I think if you're in that area, obviously you have to be careful. If you're traveling to a high-risk area, also be careful, especially if there's any chance of becoming pregnant or if you're pregnant already. But for most of us, I don't think that people need to necessarily get alarmed by this, although we should push for some steps forward, right, and address this problem more thoroughly, more comprehensively.
What are those steps? Because there's a battle over funding. You had the lawmakers in Washington left without passing a funding bill. There's been roughly $500 million, a little more than that was leftover Ebola funding that I think has been directed. But again, the governor of Florida calling on the federal government to step in with aid.
Sure. Well, there's, of course, you want to look for a vaccine or for a treatment, right, for this problem, especially for the fetus. The other issues are surveillance. So the way that they found this in the first place with a local spread, you know, people had only been going and getting tested if they went someplace that was high risk, if they had some suspicion of Zika. But people actually went door to door, public health officials, and checked folks to see if they might have Zika. That's the only way to know, to test people who wouldn't normally come forward and weren't particularly at risk. And they found that several of them actually tested positive for Zika. So we need funding for that type of surveillance also to check in all parts of the country, right, that might have this type of mosquito. Because
these mosquitoes only travel 500 feet. So that's to explain why you would have an outbreak in the Wynwood neighborhood, which is kind of like the Williamsburg of Miami. It's this hot upcoming neighborhood with graffiti everywhere. It's an arts community, but it's not anywhere, you know, it's
a small
concentrated
area.
in this one little neighborhood.
Exactly. So the CDC says this mosquito travels about 150 meters, which the equivalent is, if you think of a football field, kind of if you ran around a football field, just half that distance. So that's the lifetime of the mosquito in terms of its spread. But typically we've been thinking about mosquitoes spreading Zika to humans, but now we're realizing, well, humans can spread Zika. Humans who have Zika can spread it to the mosquito, and then the mosquito can carry it somewhere else.
I'm more concerned about what you said about how they found it in this particular neighborhood. By going, I mean, so that means maybe there's other neighborhoods along the eastern seaboard, in particular in the south, that could have Zika, and no one knows. That's very troubling to me.
And that's why also I think with the funding, I mean, we think about the treatments and the vaccines, which some private companies are getting involved in. I mean, but at the same time, we need that money for public health officials to do this surveillance, to make sure that these areas are safer, to try to do more for mosquito control. Now, for people who are pregnant or thinking about getting pregnant, so if you're pregnant, you should definitely get checked if you're going to one of these areas and you have any concerns or there's any suspicion with mosquito bites and Zika. But if you're trying to get pregnant, the main thing is if you go to some place like this, let's say you've been in Wynwood after June 15th and you've possibly been bitten by mosquitoes, or you think you might have been, you want to wait 8 weeks before actually trying to get pregnant, because that's how long a woman can carry the Zika virus in her body. But it's also concerning because for men, they carry it for longer, for 6 months if they've been infected with Zika. So if you're a couple going together, you can't just think about yourself as a woman. You also have to think about your partner, that let's say, you know, you become pregnant during this time. Well, you might have to have protected sex because you don't want that person to infect you.
Let's say you go, and even if you don't have symptoms, you should go and get a test for it just to make sure you don't have it, right?
I think it's safer to get tested if you are in one of these areas. If you're pregnant and you're nowhere near these areas, I wouldn't necessarily get tested, because sometimes that increases anxiety and the test is not perfect also. But if you have risk factors, I think it is better to get tested, of course.
Dr. Devi, thanks for being here.
Oh,
Dr. Devi and McDowell, always great to see you.
Nice to see you too.
Dr. Devi's laughing at me, but I worked on her name really hard.
Yeah, you did a perfect job. I'm impressed that you did it.
I worked on it really hard, and so I got it down. Debbie, it's great to see you.
Good to see you too, Dagen.